All right, Beverly, take a deep cleansing breath. Because it's Healthy Lung Month.
Sponsored by the American Lung Association, this month focuses on healthy lungs, especially for our senior population. Ed Neuzil, registered nurse practitioner at the Allergy, Sinus, and Asthma Family Health Center, talks about some of the conditions that affect the lungs, like asthma and COPD.
COPD is a reduction, and I'm going to use some terms here that are a little bit different. It's actually measured by spirometry. Now, spirometry is when you go into your provider's office and they have you breathe in this machine and they're actually looking for your pulmonary functions. That tells us how much air did you get out, how much did you get out the first second, and then that ratio is how we measure whether you have COPD, you don't have COPD. And so when we look at that ratio, getting below 70%, normal's 80 or above, when it goes below 70%, that's the diagnosis for COPD. And one of the big symptoms that you see is shortness of breath, difficulty getting a breath. And although COPD is associated with a history of smoking, smoking is not the only thing that can cause COPD. COPD, up until now, was not considered a treatable illness. We may not reverse someone back to what would be considered normal, but we can definitely impact the decline and improve symptoms. When we're looking at asthma, it's simply a reversible airway obstruction. When we're looking at a tree, like a bronchial tree, we see the big trunk, and as the branches go out, it finally gets out into the leaves. Well, similar situation occurs inside the lungs. We have the big breathing tube down the middle, then it divides right and left and divides out until where we finally get the breathing to occur. When we look at asthma, we're looking at the transport, what gets the air from your mouth, your nose, all the way out to where you breathe. So it's merely a transport. When we look at asthma, we're looking at obstruction of that transport line. So obviously, if you're trying to fill something, you want a bigger hose than a smaller hose. And asthma gives you that smaller hose. Fortunately, with asthma, we have, because it is a reversible airway obstruction, we have medications similar to albuterol, which is called a short-acting bronchodilator, that helps us reverse that obstruction and give us a bigger hose.
You can map the location for the Allergy, Sinus, and Asthma Family Health Center when you check out our exclusive Hometown Health Specialist directory. We've also included some web extras for various lung diseases on our website. Just click the Healthy Lungs story link on our homepage, yourhometownhealth.com.